Welcome back, friends, to another episode of Infertility and Me podcast. I'm your host, Monique Farouk. You guys may already know me, but for those who are here for the very first time, I am a women's health advocate, IVF mom to one, wife, and entrepreneur. Today, we have a very special guest. She is a writer and a PR consultant and an all around badass. Her name is Lisa McCarty, and she's joining us to tell us about her story to momhood and her trials and tribulations going through infertility, miscarriage, and a whole plethora of other things that transpired during her trying to conceive journey. So, Lisa, thank you, my dear, so much for coming on the show. I appreciate you so very much for making time for us today.
Thank you for having me.
It's my absolute pleasure. So, throughout the course of the recording, Lisa will come in and out. She has a condition where she can't stay on video very long. So, if you're watching on YouTube, please do not be alarmed. The recording will still be as usual, but we will black out the screen when Lisa needs a break from video. Okay. So, Lisa, how did you and hubby meet, girl? How did you guys get together?
So we actually met in London. We were working overseas. We both used to travel internationally a lot, and I was in a different role then. But I was working for a magazine and doing advertising sales actually prior to my communications and PR world change. And we were at a show called Farnborough Air Show in London, and we both connected through a friend who I guess I walked by his trade show booth and basically he said, I need to meet her. So long story short, we ended up meeting up at a bar and he asked me if I could meet up with him when we got back to the States. And it turned out that we lived really close by. So we got together on a group date. He kissed me goodnight and that was it. So it's been 17 years that we've been together um, and married since 2009. So
Yes, it all kinds of gets jumbled up after a while, doesn't it?
I
I
know.
do
I'm
the
like,
same.
what year is it? What day is it? Girl, I know. I just
Yes.
can't keep track. Um, but yeah,
Yes, I
it's been
love it.
a long haul with him. He's my best friend, and I'm so grateful for him.
Yes, I love it. I love it. That's why I asked that question because it always just brings joy for a lot of people to talk about it. So I
Yeah,
appreciate you sharing that with us. It sounds like that was really cool meeting overseas like that. Very cool. Very,
yeah.
very cool. So did you always know that you wanted to be a mom? Was that something that you ever gave any thought? Because it sounds like you are really ambitious. I mean, you went to school overseas and you were doing your work overseas for a while. So did you ever think that you were going to be a mom?
So I actually was just traveling overseas for work, and then I was living here. So yes, I was. I definitely have always been, and I would call myself a type A overachiever. I have a feeling you and I are probably similar that way. But yes, as far as work goes, I feel like I was always sort of ambitious when it came to that. But with respect to becoming a mom, no, I actually didn't. I kind of feel like that light bulb moment happened in my late 20s, like, right around that moment where you're like doing well in your career. And then all of a sudden, that light switch goes on and your body says, it's time, let's
Yeah.
have a baby. And then that definitely wasn't as quick as we hoped. So yeah, so that's kind of how we started.
Wow. So how long had you guys been together when you started discussing parenting
So we
possibly?
had been married a couple of years, and I actually wasn't having any menstrual cycles. So it's funny. I feel like when I think back to physical education in high school, the things that we learned, my mom actually was a PE teacher as well. So I kind of grew up watching those period videos. The ones that they showed us when we were younger, the ones that are totally just cringy now, but anyway, I feel like I knew a lot about the body, kind of the basics, but I didn't realize that it was kind of like putting two and two together. Like if I wasn't having a cycle, that I couldn't get pregnant. And, in reality, like we know our bodies, we know when something's wrong. And so I basically, I think it was one of those sort of changing moments where I went to the doctor and I said, something's going on. I don't know what's happening. My period has basically just stopped. And she said, well, you need to see an endocrinologist because I can't answer that question. So I basically made an appointment with an endocrinologist, which obviously took a few months because they're always busy. And then proceeded to have a conversation about doing sort of that baseline testing to determine if there's any other factors. And then we went into treatment, essentially. So I didn't know how far
Okay.
you wanted me to go into detail on the length of treatment because it was a long time.
Yeah. I gathered that from the article that you recently wrote from Huffington Post that it
Yeah.
was quite a bit of a process
Yeah.
from not having any children to getting to your two children now.
Yes.
And so when you initially got diagnosed, what did they diagnose you with?
I was originally diagnosed with post-amenorrhea, which is known as, lack of period. And it can happen. It is common to happen when you have been on birth control for a long period of time. And I had been on it, like many
Mhm.
women, for so long. I actually was put on it
Mhm.
initially because I was having ovarian cysts. So it was supposed to essentially reduce the frequency of ovarian cysts. This was, a million years ago. So I'm not going to say my age, but it was a while ago.
Yeah.
So essentially, I wasn't having a cycle, and they diagnosed me with post-amenorrhea, which we actually later learned was PCOS, which is, I think it's actually PCOS Awareness Month. So the timing of
Yes,
this
we're still in it.
conversation is
Yep.
interesting.
Spot
So
on. Yes.
yeah, so PCOS is kind of complicated, and I'm not sure if you're familiar, but it can, for those who've gone through fertility treatment and that are listening, it can cause complications if you're doing IUI. So we initially started with IUI, which is, intrauterine insemination, which is less sort of complicated than IVF. Um, and I feel like I kind of instinctively knew it wasn't going to work because I was always the complicated case in everything, like I wasn't having a cycle and they just couldn't figure it out. So we
Mhm.
did IUI for a couple of years before we had a switch over to IVF. And as I mentioned in my post essay, it was probably like 3 years before we even had um, the opportunity to start IVF. It was when they determined that I had PCOS that I was a better candidate for IVF because I remember my endocrinologist calling me and saying, have you heard of the Octomom? And I was like, yes. And he said, well, if you continue to do IUI, you will be worse off than the Octomom because you tend to overstimulate and your follicles are really high. And, I had like 20 follicles or 30 follicles at once. And
Wow.
he was like, and if those all decide to fertilize, we're going to be in big trouble. So he was like,
Was that
IVF.
just with minimal I'm sorry to cut you off. Was that just with minimal medications that you were getting those
Yeah.
many follicles?
Yeah. Yes. So I was
Wow.
basically like
Okay.
overstimulating. So he was like, we need a controlled scenario, which is IVF, where we're only putting one back and we can monitor every single, because I seem to recall and my memory serves me well usually. So if I'm misremembering, tell me, regarding the IUI cycle. I seem to recall that they kind of just, you know, put it in and then you hope for the best, right?
Yep.
Um, and then IVF is a lot more of a technical process because you're tracking everything. And because, at the outset of that process, he was like, IVF is just going to be your best bet because, you're overstimulating. So we actually ended up doing our first IVF, or sorry, egg retrieval rather. And then we got a good amount of eggs, and it was, during fertilization and that whole thing, it was, or sorry, as the blastocysts were sort of developing, he came back and said, we're going to put one in. We're going to try this and see how it goes. And I was like, can we put two in? I've always wanted twins. And he was like, no, we're trying this. He was a very conservative doctor, as many endocrinologists are, especially in my case, where we hadn't done it before, he was concerned. So he just wanted to make sure, it was all kind of a controlled, simple scenario. So after the retrieval, I actually ended up overstimulating and I had OHSS, which, I'm not sure if you went through that, but ovarian hyperstimulation syndrome. And essentially I had like my legs swelled up. And like I said, I'm always the 1%. I'm always the one that has
Oh my
complications.
gosh.
So I ended up overstimulating and they sent me to the emergency room. This is before I even had the transfer. At this point, they decided they were going to do a frozen transfer because my body was like telling me that it was too much. And I think my estrogen went up to like 6,000. And I wasn't even pregnant yet. Right. So it was so high. And so they sent me to the ER. I remember the nurse calling and she was like, "Are you having swelling in your legs?" And I said, "Yes, I am." And she said, "Is it more in one leg than the other?" And I was like, "Yeah, actually my right leg is more swollen." She's like, "Well, you might have DVT. So we need to get you checked out," which is essentially a potential blood clot in the leg. Deep vein thrombosis, I think is the abbreviation. Yeah. So
Yeah.
they sent me to the ER. They had an ultrasound and that whole thing. And it was very stressful. I ended up having my first panic attack. And this was kind of the beginning of awareness of mental health and how you are impacted in the infertility process. We had been going through treatment for a few years at this point. So I definitely would say it was one of those eye-opening moments because I didn't realize that just trying to have a baby could
Mhm.
impact your, physiologically, that mental health can, um, show symptoms. And, prior to that, I had never had anything, what I recall as a panic attack. Um, and my hands went numb, my arms went numb, and I was like holding the pen and the clipboard to fill out the paperwork as they're wheeling me back, because
Mhm.
they're trying, like if you have a blood clot, they want to prioritize this.
Yeah.
So anyway, so my hands went numb and I remember I couldn't feel the pen in my hand. And I thought, this isn't normal. Like at first I thought it was related to my leg, but I asked the nurse, I was like, is it normal that I can't feel my hands? And she was like, of course she was concerned. And then she said, well, are you feeling stressed? And I said, yes. And then I sort of, you realize you start to have that self-awareness in the infertility process, I think in general, like, how am I feeling today? Because you're in that constant check-in mode,
Yep. Yep.
especially when you're trying to get pregnant. So anyway, so it thankfully ended up being okay. It was just swelling as a result of fluid retention in my legs, essentially like edema, and as a result of the high estrogen level. And so we had to wait a few weeks before we did the transfer because he wanted my body to kind of calm down. So I seem to recall we had to sort of take a break and then wait, like maybe it was like a month. And then I had to kind of wait till my cycle came and then do the meds again. And then we did, I seem to recall right before the transfer, do the trigger shot and all that. So we did the IVF transfer, our first one, and um, the numbers were good on the first beta and the second beta. And I was like, wow, this is going to be, I felt
A
like I had reached
breeze,
the top of the
essentially.
mountain. Like
Yeah.
we did it, this is going to be it.
Mhm.
I'm done. Um, and so thankfully, like the pregnancy itself was relatively normal. I actually didn't tell anyone, which is probably common for many women in
Yeah.
infertility.
Mhm.
I did not tell a single person, even in my family, until I was like almost 4 months, maybe it was close to 5 months. I didn't post a
Really?
single picture on social media, nothing, because I was hesitant because of what we had basically had failures up to this point. I hadn't had any
Sure. Mhm.
miscarriages. But my husband obviously knew because he was with me through the whole process, but
Mhm.
I didn't tell friends I was going through it. I didn't even think I told my mom at this point because I was internalizing so much of it. And I felt
Okay.
like this is my problem and I didn't want to put it on anyone else. And I think so much of this, you know, process at the beginning for me was like all about not becoming a burden to other people, because we don't want to sort of project our problems into other people, and everybody has their own stuff, you know. And so I felt like if I was dealing with infertility, I needed to do it on my own, which obviously, as we know, it affects millions of women, and this is definitely not the case. We don't have to do it alone. I just didn't know that then. So essentially, went through the pregnancy, everything was good. And as I mentioned in my essay, I ended up having actually she came 3 weeks early,
Yes. Yeah.
my daughter, and she decided it was time. So it was like 3 in the morning, water broke. It was like one of those out of a movie, like a rom-com.
Yep.
Oh, honey, you know,
Yep.
there's like a liter of
Father of the bride
fluid on the
to
floor. What's
type
happening?
vibes. Yes, absolutely.
And I thought, oh my God, I'm having a baby like right now. But I
Yes.
wasn't,
Yep.
clearly. So
Mhm.
we got in the car and it was all like a big joke. I mean, my husband and I still laugh about this now because it was just one of those laughable moments. So we get to the hospital. We're like at the curb, you know, of women's health, women's delivery center, whatever.
Mhm.
And we pull up. He pulls out a wheelchair because he's nervous, and the whole thing is a
Mhm.
disaster. And the wheelchair, as soon as I go to sit down, and I'm like having contractions on the way there,
Wow. Wow.
and I'm like on the ground every time. Actually, right before we got in the car, this is
Mhm.
another funny scenario, but he goes to the car, he's starting the car, puts the bag in the car, comes back, and I'm on the floor. I had to
Oh
lay down every
no.
time I had a contraction because it was so intense, like she was coming so fast.
Wow.
So we got to the hospital and they take us, you know, or sorry, we get to the curb, and the wheelchair, he pulls it out and I go to sit down and it's broken. Like literally the
Whoa.
wheel is missing and I'm like almost on the ground and we're both laughing. And the
Oh,
nurse comes out and
see.
she's like, "All right, you know what, husband, go park the car. We're
Right,
done
let me
here.
handle it.
I got her."
Oh my gosh.
So he was a mess. It was so funny. But anyway, so we got in normal delivery. Actually, we ended up having to pause because the OB wasn't available. It was all just a big joke. Um, like I felt like I was on
Yeah.
candid camera the whole time. So intense contractions, didn't even have time for an epidural. So then they tried to do the epidural and I think it didn't work on one side. So my
Okay.
right side, I could feel everything. My left
Mhm.
side, nothing. And so delivery was okay. And then it ended up being um, a total complication with the placenta. They couldn't get it out. She worked for 45 minutes. And I think the average amount of time for placenta is 45 minutes to an hour that women can safely have, you know, sort of a manual extraction of it.
Mhm.
But I had lost so much blood. I had a hemorrhage, I probably close to a liter of blood at that point. And so they sent
Mhm.
me back to an emergency DNC. And they were like, I don't honestly know why they waited that long. And in this
Yeah.
current maternal health crisis that we're in right now, I can see how women have this issue often because I think doctors are doing the best they can. I don't fault my
Yeah.
doctor, but
Yeah.
I think it should have happened sooner. So I ended up doing a DNC, which is a trauma to the uterus.
Yeah.
And, you know, my recovery was relatively normal. And everything was okay. She was obviously, you know, my kiddo was fine.
Mhm.
But I'd say it ended up being sort of a traumatic experience because it was supposed to just be delivery and like let's get this done and have a baby and then you go home and it's all the social media pictures and all that, but
Mhm.
that's not
Mhm.
actually how it happened. So
Yeah.
then 16 months later I decided I wanted to have another one, you know, the light
Okay.
switch came back on, if you will.
Mhm.
And
That itch.
yeah, what is that
Yes,
anyway?
indeed.
It's like that
Oh
maternal
my
need, that
gosh.
innate, you know, feeling you get in your womb
Deep
to
into
have
your womb.
something.
Yes, absolutely.
And so I thought because it happened in my mind quickly, which was 3
Mhm.
years for her, that maybe we would, and we had success with IVF. Like I thought we had kind of figured it out. So I
Right.
thought it would be no
A
problem. Like it would
breeze,
be like,
essentially.
all right, I've
Yeah.
got remaining embryos. Let's just do this thing. Let's just have, do one more IVF. I'll have some left. Maybe we'll have another one eventually.
Mhm.
No, not the case. So, we went on for almost 4 years. We ended up doing another retrieval because I basically used the remaining embryos that I had. It ended up being a total of 14 IVF cycles. And
Wow.
so that last year, and I talked about this in my essay as well, the last year was the most horrendous because it was just loss after loss after loss after loss. It was 4 in a row. And that last one was just
The
debilitating.
one
It
that,
was
yeah, yeah.
talk about, mental health impact. I don't even think, yes, I was physically coping with the grief of miscarriage, but I was not
Mhm.
mentally coping with any of it. Like I just wanted to have another baby. And I was so
Mhm.
focused
Mhm.
on that I just like, I mean, obviously like it brought me to the floor of the bathroom, that last one
Yeah.
on the floor with my husband. He's holding me and, like I'm just thinking, what is wrong with me? Like there has to be a reason why. Like we went from successful IVF the first time to just failed attempts and then a series of 4 losses. So that's when that last one, I went to my endocrinologist and I said, what's wrong with me? Like,
Mhm. Mhm.
what have we
Mhm.
not looked at? And he said, I think you need to see a specialist. And to which I said, I thought you were the specialist.
Right,
You're supposed to,
hello. This is why I'm
what
here,
the
sir.
hell, So,
Yeah.
and he was just like, he still, is one of the people I credit to just keeping me calm. Of course, my husband being the grounded one who got me through this,
Mhm.
but my endocrinologist always just had my best interest in mind, just so conservative, always wanted to think outside the box. And they had basically thrown the
Mhm.
kitchen sink at me at this point. I had tried ERA, I had tried, you know, calculating the timing of it. We tried doing different medications. We
Mhm.
tried a different trigger shot a few times because a couple of the cycles, the trigger shot didn't work. Like we switched
Okay.
from Lupron to HCG or something. I can't remember.
Yeah.
Anyway, so it was all, it's all trial and error.
Yep.
They don't actually know the answer. It's just everybody is different. And so we went back into his office and he said, you need to see a specialist. There's this doctor who does gynecological surgery and he knows all about these pelvic and reproductive conditions. And there's a chance that you may have something else going on. And I'm like, well, what is it? Well, what do you think it
Mhm.
is? And he's like, I don't know.
Yeah.
So
Mm.
I went to the specialist and essentially, he brings you in. It took me several months to get this appointment. So it was like also more waiting. This whole process is hurry
Yeah,
up and
and you're a
wait.
new mom. You're a new mom at this
Yeah.
point.
And
You got
it's
a toddler.
exactly. And I know I would definitely say for those who have gone through this with another child, this sort of primary and secondary infertility scenario, the secondary piece, you can't just make it go away. You can't just pretend like you're fine. Kids, they pick up on this stuff. They know when mom is not right. And so I definitely feel like she sensed that. She sensed my anxiety. She
Mm.
sensed my feeling, of unease on a regular basis. Um, but I feel like she was just such an easy kid. I was so
Mm.
grateful because um, we didn't have a lot of issues sort of managing that. I was grateful because I was able to stay at home with her. So I was taking care of her, not really taking care of myself as well as I could have been. Um, and over that 4 years prior to seeing the specialist, I was having increased anxiety as well. So I was
Mm.
having more panic attacks. And that last miscarriage, I definitely felt like, the hands went numb again. And I felt like that
Mm.
same feeling that I had back right before that ultrasound happened,
Yeah.
when they thought I had a blood clot. So
Yeah.
it's interesting. This whole process, it sort of creates an awareness within you. If you have that self awareness of how you feel and how anxiety affects you in a physiological way, you know, heart rate increase, hands going numb,
Mm-hmm.
headaches, crying, on a regular basis, being triggered easily, having a hard time attending events because you're just so affected by this and you're just holding it all in because you just don't want to talk about it. And I think all of those things are really horrible because it makes you feel like you're struggling in silence. So anyway, going back to the specialist, so I saw the specialist,
Mm-hmm.
finally, and he did an evaluation, physical exam, and we kind of talked about the history of my DNC after my daughter was born, and then
Mm-hmm.
I had a couple of subsequent DNCs after my miscarriages. So, and one of them I think may have been an incomplete miscarriage because we didn't do a DNC on one.
Mm.
So he said, you're, it's, I'm suspecting it could be something called Asherman syndrome. And at this time, I had no idea what that was.
What
I
it
had
was,
never heard
yeah.
of it before. And so he said, basically, we need to make another appointment to do an evaluation, hysteroscopy,
Mm-hmm.
which basically is, like a 16-inch long tool with a camera on the end to determine what's going on. And he said, if I see scarring in the uterus, I'm basically going to take it out.
Okay.
And then we'll have a confirmation that it's Asherman's. So, yeah, so we basically did that evaluation. He saw a lot of scarring at the top,
Mm-hmm.
which is called the fundus of the
Mm-hmm.
uterus, and also some scarring in the center of the uterus, which he said, um, looks like web-like scarring, where it can
Mm-hmm.
impact implantation. And
Mm-hmm.
so he said that he thought that was the reason why I was having the recurrent miscarriage. And he wanted to do this series of 4 treatments. And so basically the treatments were removing the scar tissue. And then 2 weeks later, I went back. In between those treatments, prior to the second appointment, he had me do estrogen vaginally. And this essentially helps to heal the endometrial lining, so that ideally the scar tissue doesn't come back. And so the second appointment, the scar tissue did come back. And so he said,
Mm.
okay, we're going to take it out. It was a little bit less than the first time, but it was still significant.
Okay.
So did the did the estrogen again for 2 weeks. And then the third appointment, it came back again.
Mm-hmm.
It's like a vicious cycle. It really is, because
Okay.
when you have a DNC, it's trauma to the uterus that can cause scarring. When you do these procedures, it's another trauma to the uterus. So it's like the body is learning, it's almost like attacking itself or something, almost like
Yeah.
in a
Yeah.
response that my body just knew how to make scar tissue really well. So anyway, we come back to that fourth appointment and he said, we're going to go in, we're going to see what we see. And if
Mm-hmm.
there's scar tissue, I'll take it out and we may have to do a fifth procedure. If it's not present, then we'll make a plan, basically. And I said, okay. So he did the evaluation again
Mm-hmm.
with, the scope, 16
Mm-hmm.
long, inch long piece of equipment. It's like 2 to 3 in diameter, 2 to 3 centimeters or
Yeah.
something. Really
Yeah.
small. It sounds crazy, but like, so you watch this whole thing on camera, by the way, like the entire
Right.
time you're awake in the procedure. Um, and so he went in that fourth time and there was no scarring. And he said, I don't see anything. And I was like bawling,
I
in
know,
the chair.
right.
I'm like, and he said, now I think you can try to have another baby.
How
And
long
I
was
was like
the
hugging,
span of
trying
time?
not to hug him. So I'm like, this is,
Yeah.
But he was
Yes.
just the kindest man. Sorry, you were going to ask a question.
I was wondering what the span of time was in between each of the hysteroscopies that were being checked as you were being treated with the estrace and
Yeah,
such.
so
How
they were
long was that
2
time
weeks
frame?
apart.
Okay.
So 2 weeks of estrogen in between each appointment. So
Mhm.
from the time that the endocrinologist told me to go to the specialist, which, it took me, as I said, a few months to get an appointment, and then making that additional appointment, and then
Mhm.
actually having that fourth appointment where he said everything, was clear, was probably
Mhm.
like 6 months. Maybe it was a little
Yeah.
bit longer. I don't know.
Okay.
I feel like I blocked it out, some of it
Yeah,
because
and the small details of it, yeah, sometimes
yeah,
they get lost in there, yeah.
yeah,
So,
the
when the
time
time
frame.
from the first hysteroscopy to the last before you started trying
That was
again for your
probably a
sibling,
couple of
like
months.
the 2 or
So,
3
yeah, so
months,
it's about
yeah.
2 weeks
Okay,
apart. Yeah.
gotcha.
Yeah, and we
Okay.
did 4 of them.
Wow.
Yeah. Yeah, so it was a long process, but, um, so essentially, yeah, I walked out to the waiting room and talked to my husband, and I'm, like, hugging him going, "Oh my god, maybe we have another shot." So at this point, we had 1 embryo left, and then that was it, and this was the last chance before surrogacy. And I was
Mm,
100% on board with surrogacy. I was like, let's do
okay.
this. I had actually already talked to the surrogate folks at the clinic. They
Mhm.
gave me all the paperwork, and they were like, you know,
So you were ready to go, yeah.
I was ready.
Trying to stay
Yeah.
10
I
steps
mean,
ahead, right? At all
yeah. But
times,
at the same time, it's so expensive. So, like, we
isn't
weren't,
it? Oh my gosh.
we were trying to figure, like, racking our brain, like, how are we going to afford this? We're not going to be able to afford college for our first child,
Oh my
trying to
gosh.
have a second. Um, so anyway, so basically I went back to my endocrinologist, and he said, I need to consult my board to make sure that they are
Mm,
okay with this last transfer. Um,
okay.
and here I am thinking, like, let's go, let's start. Like, I need this last transfer.
Mhm.
And he was like, well, hold up. Like, I need to get permission. In my 30 years of practice, I've never seen a case like yours. So we need to, like, check. And so essentially we had to, like, wait another, I think it was like another week.
Mhm,
So he
mhm.
talked to them, and he came back to me, he said, okay, I've been given permission. This is your last shot, basically.
Wow.
So this was our 14th transfer. So, which
Wow.
is like, yeah, I know, right? It's insane the amount of things
Yeah.
that our body and minds can go through in this process. Um, so we did the transfer. And it was a couple, whatever, after we did stims and all that again, because we another frozen transfer was our last one. And
Okay.
so we did the transfer, and the entire 2 week wait right before we got the beta, I was
Mhm.
just waiting for the other shoe to drop, because at this point I had had 4 failures in a row, or 4 losses in a row rather, and I felt like I was just expecting it to go wrong, um, and anticipating, ruminating, all the things that our mind
Mhm.
does when we are in that state of anxiety and fight or flight, where, I would regularly wake up during that 2 week wait, like, checking to see if I was bleeding.
Mhm.
That
Okay.
constant need to know, which I went through years of therapy for this, cognitive behavioral therapy, and I learned a lot of
Mm.
coping tools. But one of the things that I learned through this process and applied in the 2 week wait was that I needed to stop trying to know the answer, because I
Mm.
couldn't know the answer. There was no way to know until the 2 week wait was over. And I think that's something that so many women in going through treatment, regardless of where you are in your journey, we always
Yep.
want to know the answer, like, now. Like, can I just know if I'm
Yep.
pregnant now? Can I know if this is going to fail now? Because I don't want to know about it later. It needs to happen. Um, so, what I learned in my process through this, especially this last one after so many losses,
Mhm.
was that I needed to stay present. I needed to focus on what was happening right now. Right now, I'm still pregnant, potentially. it was like that moment of like reminding myself, I'm not bleeding right now. Today, everything is okay. And
Right.
that helped me get through that last 2 weeks before the beta. And so the numbers were good. And then we had our second beta, and the numbers were really good. And I was just waiting because it was always that second beta that I got the call that it
Mm-hmm.
wasn't working. And
Mm.
in fact, when I go back to my first loss, I remember I was bleeding before I even got the call. Um,
Mm.
so in so many cases, we just don't know what's going to happen. Um, so yeah, so the beta was good, and then we went to the third, and then somehow we ended up at the 10-week ultrasound, and I was like, oh my God,
This
and
can't be real, right?
they're like, we're kicking you out. And I was like, no, can you just keep me a little bit longer just to make sure
Yeah.
that this isn't going to fail like the other ones? And I remember my endocrinologist like put his hands on my shoulders and he's like, it's going to be okay. You have
Mm.
to tell yourself that you're going to be okay. And I was just, it's such an emotional process. And to have the doctor say, I'm going to be okay when I keep thinking I'm going to fail, um,
Yeah.
it's hard. It's really hard.
Yeah, it's really difficult. And my deepest sympathies for all of your losses too, as well. Didn't want
Thank
to
you.
skip over that. Yes. So did you stay with the same endocrinologist through your entire
I
14
did.
span?
Yeah. So I was with
Wonderful.
him almost 10 years on and off.
Wow.
Yeah. So like, cause we
Wow.
took that break and then there was another. Yeah. So it was close to a decade.
Wow.
Yeah. Long time. And he said to me right before that transfer, he said, I'm going to be retiring in the next year, but I'm not retiring until we get you pregnant and get you to have another baby. And I remember thinking that is a sign of a good doctor when he doesn't want to give
Yes,
up on you,
absolutely.
whether
Yeah,
it
and
needs
he's
to be a
thinking about you.
surrogacy
Yeah.
or myself. So we
Yes,
ended up
that's wonderful.
having our second, and I, of course, that entire pregnancy, I was an anxious mess because
Mhm.
I had had so many losses, and of all the things that we had been through, I felt like it was like that pressure for this was our last shot. So it was also that pressure that we put on ourselves to make it work. Like if our
Mhm.
body isn't working, like we can't control that. There's so
No.
much about infertility that we can't control. I mean, all of it, really.
Yep.
And I think that's why, it's so important to find a community. And I didn't actually find that community until I had my losses.
Mm.
So it was several years of doing it on my own. And I connected with other women. I started talking about with just like one or two friends. And then it ended up being, oh, well, there's support groups for this. Oh, there's other things you can do. And I
Mhm.
kind of felt like I had wished that I had done it sooner. And there's
Mm.
so many incredible resources. I know you probably know all of them, but Resolve is one of the most helpful, I think, in my
Yeah.
process because they had access to support groups and,
Yeah.
they're free. Um,
Mhm.
because so many women at the beginning of my infertility journey that I knew were all just having babies. They're all just having babies.
Mm.
So many babies,
Yeah.
baby showers, birthday parties, it just kept adding up. And I'm like, I couldn't talk about it with them, like, because I
Mhm.
just felt like they didn't understand. So you
Yeah.
really do feel like it's so much of this process, like you're expected to do it alone. Um,
Yeah.
and
Yeah.
then,
That goes back to that silent suffering that I'm always talking about here on the platform and on Instagram as well. One of the
yeah,
terms I deem that I coined,
yeah,
because I too did the same thing. It wasn't
yeah,
until the summer that I got pregnant with my son that I started telling people outside of my mom and dad. And
yeah.
so I resonate with that so very much. And it's like now I can't stop telling
Talking
everybody,
about it,
that's how
right?
it feels. Yes.
Yes.
Oh my gosh.
Yeah, there's a quote, and I want to say Melinda French Gates said something like,
Okay.
"Once you find your voice, you will never want to stop talking because you never want to stop sharing it because if we talk about it more and we decrease that stigma and decrease that, you know, sort of ignorance about it. For lack of
Yep.
a better word, it is ignorance, because so many people outside of
Perfect
the
word.
infertility
Yeah.
community don't understand what it's like. And so we end up putting it back on ourselves and, like you said, struggling in silence. And that silence is deafening, because we end up, I was depressed and I was isolated and I was anxious and I
Hmm.
was having all
Hmm.
these things going on. I waited until I was basically showing, which obviously happened a lot sooner with my second, until I told people, let's not speculate, let's not have rumors, like, let's just,
Mm.
but support each
Yeah.
other and empathize and listen. You don't always have to offer a solution to someone who's struggling, you know?
And most of the time, I feel like most people, if somebody's looking for a solution, they'll ask you specific. I can't talk today. Jeez, me Christmas. I feel like most of the time, people, when they are looking for solutions, they will
Yeah.
ask you for solution type questions. They will ask you
Yes.
a certain way. And
Yes.
again, I'm just already saying it. They'll ask you. But most of the time, I feel like people just want a lending, a shoulder to cry on, or ear,
Yes.
or
Yes.
just support in the physical sense of needing the care and the empathy of another person. When people want solutions, they will ask specific questions that are solution
That's so true.
oriented or based. You know what I mean? So,
Yeah.
and I feel like for people like yourself who are A type, you're probably one of those kind of people like that are not really looking for solutions. Like, I just need you to listen to me and tell me if I'm going crazy or not. Like, I
Yeah.
probably already have it figured out, but I'm not quite sure.
Yeah.
And I just
Sometimes
need some
having a sounding board
confirmation.
is helpful.
Yeah.
But that empathy is so valuable, because when someone is listening and supporting, I feel like, when we're in that process, it's validating. It's so
Mhm.
validating to know that someone is trying to understand, versus
Mhm.
just saying things like, well, at least you already have one child, you know,
Right. Right. Right.
or, at least you can get pregnant. It's like all the
Mhm.
things not to say when you're trying to
Yeah.
support someone. So,
Yeah, but not, and then they're not even knowing how long it took you to get pregnant the
right,
first time, or how
right.
much of a burden and hill that was to climb,
Yeah,
as well as all of the emotional turmoil that you were going through with
yeah,
anxiety and depression. And I feel like people need to start uh, asking questions and being curious instead of just making assumptions with their responses. But
yes,
that's a whole other topic for a different day, because I could go on and on about that type of behavior too. But
yeah.
so, as a writer and PR specialist, when did you decide that you wanted to be more of a vocal advocate? How long after your second baby?
So my son is actually turning 5 in February. So I started writing about this on my own, probably like a couple of years ago. I
Okay.
mean, I've been writing in general in my role in PR, and also sort of independently, I would say,
Hmm.
since college, a long time, um, 20 years. But with respect to this story and these experiences, it's been,
Hmm.
you know, the last year or so, I just started sort of coming to realize that I needed to start dealing with it. And I don't even know that
Mm.
I don't even think I knew I wasn't coping. So
Mm.
writing became a powerful tool for me to cope in the first place. And so I think it sort of happened organically, where I thought, maybe some of these words could help someone else. Maybe sharing my story could help someone else to feel like they're less alone. And in that
Hmm.
process of feeling less alone, maybe I can also offer some tools to help them to implement, so that they can do and feel better. Because
Hmm.
when I was going through it, I would have liked to have had that. And I didn't. I didn't have other people to say, well, I went through that too, with an exception of when I went through my miscarriages, and I had a couple of friends say to me, well, I had a miscarriage too. And I was like, really? Like, oh, I thought we weren't supposed to talk about
Mm.
that. Um, And so the writing kind of happened organically. And so then I started sharing my story. And the first story that I shared publicly was earlier this year, was on Today Show, on today.com, about my dad and losing my dad. So it's been 4 years since he passed, but the day that I was induced to have my son, because my fluid dropped, was the day that I said goodbye to my dad. So I thought to myself, if I write this, what will happen? So I just like wrote it all out. And then I thought, maybe someone else has gone through this. Maybe this could help someone else. And so I guess over the last year, I really started thinking, I needed to pay it forward, if you will, because why, if we know ways to get through things, and if we have learned things in our experiences, why not share them? Why would we hold that to ourselves? Why would we not want to help other women who are going through it? And this is for all women's health issues. I mean, mental health, maternal health.
It all kind of stems together, I feel like.
It really does. Yeah. And I think the more we talk about this stuff in general, like you were saying earlier, it's so important to bring it to the surface and create an awareness about it, because if we don't, then we're just going to all continue feeling this awful feeling of isolation. And I know on social media too, like I try to share like inspirational messages and, really keep it real like you do. I love all your videos, by the way. You just make me, it just really like brightens my day, because I think this is so real. You are just so real. And I think your authenticity is refreshing.
Oh, thank you.
But I think it's really important to be that authentic person on social media, because there's so much that isn't real,
So much curation going on. That's the new trendy word,
and
right?
I get
Curation.
it. Like, there's the influencer, but I almost feel like I'm like the influencer, because I just want to share what's on my mind and whatever I'm experiencing that day, and also resonate with people who may be going through it, because I have my own community, on my social page on Instagram, that, women who are going through infertility, they follow me and I follow them, and we have little circles where we have conversations, and they ask questions to each other. And I feel like at least I'm sharing, what I went through for a purpose, like all this pain, I have to turn it into something positive, because it feels like at least I'm doing something, like
I understand
instead
that
of,
yeah.
And those who are going through it, of course, like if you don't want to talk about it, you don't have to, but just know that there are options to talk about it, because writing is great, but if you don't write, that's okay. I mean, listening to your podcast and, following people on social media that are helpful, I feel like is also supportive to you, because if you're following people that make you feel worse, unfollow them, like disconnect. Don't force yourself to feel like you need to be somewhere just because that person is popular,
Yeah. That
I think
clicky
eliminating
nature that us women sometimes have, it's kind of spills over into the community, unfortunately, sometimes. But I totally agree. What were you going to say, dear?
Oh, I was just going to say, I think it's important to surround yourself with the people that feel the most supportive in this process. And that goes for mental health in general, during and after treatment. And for those who didn't have success with infertility, there are options for support too. I mean, there are so many women that I know, that I follow, that are talking about this childless after infertility, because there is another part of this. There is like I was lucky, and I recognize that every single day. But there is another part to this, that like I could have been that person. And sometimes I think about, like, what if that IVF had never worked for us? And also, what if the second one hadn't worked? So it's definitely like a whole other world, and considering, looking at ways to feel supported, writing, meditation, yoga has been really helpful for me, walking as well. There's definitely like something about going for a walk to get your mind to calm down when you're feeling that sort of overload of the situation. So those are kind of the tools that
Absolutely.
I use. Even now, I'm 5 years out of treatment almost, which it feels like it was like another job, a full-time job
Yeah.
that we all, feel like
Hmm.
you're in. And then now that I'm out of it, it's strange to say. I do sort of just miss it a little bit. Not the horrible
Mm,
things about it, but I miss the people that helped me
mm,
because
mm.
they do it every day,
Yeah. Yeah.
and
And that
they're
support that you
they're
felt from
incredible.
them too, I'm sure. Yeah.
Yeah,
Well, I thank you for giving us all your wisdom because my last question is usually what advice would you have or a word you would have for the community that especially for someone who's new and maybe
yeah,
newly diagnosed, or even that person who's been in it for a very long time, like
yeah,
you had been in the past 5 or 10 years has gone by and still without any I really don't want to say successes, but without the outcome that they likely
yeah,
would have wanted to have.
yeah,
If there's a last word you would or a word of wisdom that you would
yeah.
have for them. Yeah.
I would just say support. I mean, really, that's the best thing you can do for yourself is find support, whether that be mental health support for yourself.
Hmm.
Not everybody believes in therapy, but I do think that it's a very valuable tool. I learned how to change my pathway of thinking in cognitive behavioral therapy. Um, I learned how to keep myself in the present and other coping tools. If therapy isn't for you, that's okay. Look at free support services, through Resolve, and obviously on social media too. I think you have an incredible platform. People need to really, you know, reach out. Don't feel like you have to do it alone. Without that support,
Hmm.
we are struggling in silence, and you don't have to be.
Yes, absolutely. Lisa, give us your Instagram handle so we can follow you as
Sure.
well as read your pieces that you have written in the
Yeah, I
last
would be
year.
grateful. Thank you for sharing that. It's LB McCarty. Oh, is that right? Oh my gosh, I don't even know my handle. Girl, I'm old.
It'll be in the show
It'll be
details, you guys.
LB
Don't even
McCarty
worry about it.
717, I think. But just
Yes,
just check
LB
the
McCarty
caption
717.
and,
Yeah.
and Monique will hook you up. Thank you so much for
Yes,
having me. And I
absolutely.
hope this was helpful for you and for your listeners. And um, please just know that you're not alone. That's the best thing I can say too.
Yep, and we're going to end it right there. You guys know where to find me on the gram, Infertility and Me Podcast, as well as on YouTube at Infertility and Me Podcast. For a while, we were just doing still frame videos to decrease my workload, but visuals are now available again on YouTube. So if you would like to consume the content there, that is also an option for you. But you can always find me on Instagram. Peace and blessings, friends. Thank you.